where the surgical correction is the best option. Then varicocele and fertility. So many patients who approaches us with post varicocelectomy and they come to our OPD. So डॉक्टर साहब हमारे डॉक्टर साहब ने बोला कि हमारे दोनों टेस्टिस में वेरिकोसिल है, ग्रेड 2 में है, तो हमने ऑपरेट कर लिया। अभी हम 1 साल से कोशिश कर रहे हैं कि हम कंसीव नहीं हो रहे। तो वेरिकोसिल का ऑपरेशन जितना हो सके उतना मत करना बोलना है पेशेंट को। अगर वो वेरिकोसिल का ऑपरेशन करेंगे तो पॉसिबिलिटी ऑफ एडिशंस, पॉसिबिलिटी ऑफ कंप्लीट ब्लॉकेजेस में हैपन। मेनी पेशेंट्स वी हैव सीन ट्रांसिएंट और टेम्पररी इंप्रूवमेंट होता है। वेरिकोसिल का डायलिटेशन करके उसको पूरा सर्जरी करके ठीक करने के बाद पॉसिबिलिटी क्या है कि नेक्स्ट एक सेमेन एनालिसिस में 2 सेमेन एनालिसिस में नॉर्मल आ जाता है, लेकिन बाद में 2-3 महीने छोड़ने के बाद वो वैसा ही कंटिन्यू रहेगा। मेनी पेशेंट्स, वेरी फ्यू पेशेंट्स आर गेटिंग रिकवर्ड। सो दैट इज व्हाई आस्क द पेशेंट टू डोंट गो फॉर वेरिकोसिल का सर्जरी मत करने के लिए बोलते हैं पेशेंट को। So क्यों होता है ये वेरिकोसिल? Because of increased testicular temperature. That's why I told you that those people who are working in a very high temperature area or radiation area, increased intratesticular pressures because of excessive tight undergarments wearing or very thick and tight undergarments using. Now a fashion is coming up when we go for a local examination of the patient. They are using very tight underwears with not cotton. They are mixed up with some other materials. So don't wear such materials for long duration of time. So they arrest the spermatogenesis, they increase the more temperature. That is why the testes are outside the body because it requires less 2 degree temperature of the body, less 2 degree less temperature of the body temperature. That's why they are outside the sac of the abdomen. So when you go for semen analysis, this should always be kept in your mind that first and foremost thing when a patient comes with a male infertility, when you make a diagnosis, the first thing you have to go for is semen analysis. लेना चाहिए क्लीन एंड हाइजीनिक एंड स्टराइल कंटेनर में उसको सीमेन सैंपल को कलेक्ट करना है और वो लैब में आकर ही कलेक्ट करने के लिए बोलना है, घर में कलेक्ट करने के लिए नहीं बोलना है। कलेक्शन करके 15 से 30 मिनट के अंदर उसका एग्जामिनेशन होना ज़रूरी है और कलेक्शन करने के बाद वो बॉटल को ज़्यादा हिलाना नहीं है। सो इट शुड नॉट बी शेकन फॉर ए लॉन्ग। व्हेन दे ब्रिंग द सैंपल फ्रॉम द होम इन ए गिवन बॉक्स और ए गिवन collection box, so they come on in the vehicle or a two-wheeler or they come by cycle or they come by walking, so it gets more mixed up, so the results will be varied. So results are not accurately predicted or the semen analysis report is not perfect to that particular point. So best option would be ask the patient to go to the laboratory, or if you have a lab you can do it in your own hospital and you can collect the semen sample correctly. Ask the patient to. There should not be any spillage when they collect the sample. So that whatever the collection sample collection box or bottle you are giving, it should have a wide mouth. Should have a wide mouth. Sterile container should be there. That container should have a wide mouth so that the sample can be collected very easily. And most important thing is the patient should have a peace of mind. Because that ambience you have to provide. When they go to the lab, the environment or many people are sitting outside, some person is standing outside the washroom and patient is there inside the washroom and trying to collect the semen sample. They don't get the urge. So erection will not happen. They could not able to collect the sample. So many times it causes very, very difficult situation for the patient. They feel very bad and odd about such situation. So you need to provide such an ambience to the patient where they get good erection and to collect the sample. And many patients, it happens that they could not able to collect the semen sample in the laboratories. So in IPD, you provide them one room. So ask both the couples in the room. So together with them, they feel the erection, they bring that particular mood and a proper erection will be there and you can collect the sample, they can collect the sample very easily. So forcefully or without having the emotions and without having the proper erection, you could not able to get the proper sample. And the gap between 3 to 5 days is very, very essential. You have to make them to understand the importance of 3 to 5 days of a gap. So that's why it's very, very important. You have to give all these strict guidelines, because many labs don't give all these guidelines at all. Because many times semen sample will be collected by the lab technicians. Patient don't know much of the things. So that's why you should make them to understand all these things. So volume should be more than 2 ml for normal. Then pH should be 7.2 to 7.8. Viscosity should be less than 3, or scale of 0 to 4. Then sperm concentration 20 million, it should be more than 20 million per ml. Then total semen count should be more than 40 million per ejaculate. And semenogram or semen analysis normogram. So if the motility is more than 50%, progressive forward motilities are there, that is normal. Morphologically, if 14% of normal forms are there, then it is considered as a normogram. Viability 75% or more living or live sperms are there, then it is called as normal. Leukocytes less than 1 million per ml is considered as normal. Then sperm agglutination, 10% spermatozoa with adherent particles may be acceptable, and fructose content in the seminal fluid should be positive. Many times, many laboratories, even IVF centers, don't give this fructose content test because it also costs to the patient. They don't make them patient to understand the importance of fructose test. So when you write a semen analysis along with the fructose test, you have to write in your prescription when you send the patient for that, because many times the semen analysis report does not give the fructose is present or absent. So even it can be measured and it can be mentioned, because fructose is a very, very important nutrient material for the spermatozoa to travel across the vagina along with the inside the lumen of the inside the cervical canal and to go for a conception. So till that it has to travel, means it need to have a very good source of energy, and that energy comes from the fructose. So abnormalities, the sperm count abnormalities, count, motility, and morphology. 3 important characteristics are there. So semen concentration will be reduced, or motility will be disturbed, or structural abnormalities may be observed. Either volume will be low, or concentration will be low, motility will be low, or morphologically abnormal things are there. And diagnostic nomenclatures, aspermia. What is aspermia? There is no pavanendriya. After long term intercourse also they could not able to collect the semen, or ejaculation is not happening. That is called as aspermia. Oligospermia or oligoazoospermia. So if the count is less than 20 million per ml, it is called as oligospermia or oligoazoospermia. Then polyzoospermia. So count is more than normal. So that's also abnormal. That is also Shukravriddhi Lakshanas. You can consider as a Shukravriddhi Lakshanas. So polyzoospermia can be considered for that particular domain in Ayurveda. Azoospermia, completely loss of spermatozoas. No spermatozoas are there. And asthenozoospermia, so the motility of the spermatozoas are disturbed. So motility is linear progressive or fast progressive is reduced, or slow progressive is reduced, or immotile or dead sperms are there. Then leukocytospermia, increased white blood cells. Necrozoospermia, spermatozoas are dead and there is no motility of the spermatozoas. So teratozoospermia, more than 70% of spermatozoas are having abnormals in structures or morphologically abnormal. Oates syndrome. So all the 3 variables are found, that is count, then motility and morphology. If all these 3 things are abnormal, then that particular condition is called as oat. It is oligo, astheno, teratozoospermia. So teratozoospermia. So this is called as a oat syndrome. Clinical diagnosis based on the hormonal status. So if the normal men, obstructive, FSH, LH, and you have to observe, and testosterone. If FSH is increased, then spermatogenetic failure will be there. And if FSH and LH both are increased, there is a testicular failure you can identify. Then if all the 3, that is the FSH, LH, and testosterone both are decreased or reduced, then hypogonadism will be there, that you can identify. Pre-testicular, testicular, and post-testicular you can identify through this. Then the effect of thyroid hormones, hypothyroidism and hyperthyroidism, two clinical conditions. Erectile dysfunction, teratospermia, asthenospermia, oligospermia, all are because of the thyroid disorders or dysfunction of the thyroid hormones. So in hypothyroidism, there will be obesity, there will be slow motility, structural abnormality can be found, and in hyper, there will be decreased motility, and there will be a increased estrogen levels. So anti-sperm antibodies. So these things can be understood. Anti-sperm antibodies. So they reject for the anya dhatupa samsishtaha. So this you can understand through the anti-sperm antibodies. Cytotoxic effects can be observed on the spermatozoa, cell death, immobilization of the sperms. Then agglutination or clumps or the clots will be formed in the semen sample and hampering the passage of the sperm through the cervical mucus, and there is no possibility of natural conception. How to measure male infertility? First, you have to go for a semen analysis. Second, you have to go for specialized sperm function test, HOS, ROS. So sperm integrity function test. All those things are done under the CASA analysis. Then scrotal ultrasound, color Dopplers, then transrectal ultrasound. Then you can also go for hormonal assays. You can also go for post-ejaculation urine analysis for retrograde ejaculation. Then some other genetic karyotyping. All those things can also be done. Then any testicular biopsies. And factors influencing male infertility, dhvaja dhrutihi. So the erection disorders, shukra guna, the quality of the semen, quality of the shukra dhatu, fertility. Dhvaja. So proper erection plays an important role in helping for the depositing the semen, ejaculated semen high up in the vagina. That's very, very important. So treatment principles. Swastheya Vajikarana can be given. Swastha Purushas, you can also suggest for the Shodhana followed by Vajikarana Chikitsa. And you can also give Shodhana, that is Shukra Dosha Hara Chikitsa, Shukra Shodhana Chikitsa can be done. Then Shukra Sruti Dosha Hara, that is ejaculated dysfunction, you can go for Shukra Sruti Dosha Hara Chikitsa. Then erection disorders, then you can go for Klaiba Chikitsa. Some of the other chikitsas with particular Roga Adhikara can also be done, because some of the patient comes to your OPD with a very long-term persistence of a disease suffering that can also result into infertility. So that specific diseases can be identified, disease-specific treatment can be adopted. In Swastheya Vajikarana, Ete Vajikara Yogaha, Priti Apatya Balapradaha. Why important is Vajikarana? Priti Apatya Balapradaha. So Balaprada, Apatya Santanakaram, Yat Sampraharshanam. Both the things are there. Sevya Vishuddha Upachita Dehihi. Kaladi Apikshayaha. So depending on the kalas, you have to go for Shodhanadi Karma, then Upachita Dehihi. So after proper nourishment of the body, post Shodhana Karma, Upachita Shariraihi, Upachita Dehaihi. He has not used the word Sharira, he has used the word Deha. Deha is Deha Vardhati, that which always grows. So Upachita Dehaihi. So all Sarva Sampurna, all Saptadhatus are developed properly. Post Shodhana, you have to observe all these things. So Dhatu Samya is happening in the body or not. So by the administration of Vajikarana Yogas, you can improve the Apatya Bala in patients. Shukra Dosha Hara Chikitsa. Yatha Dosha Sneha Svedadi Kriyaha. Further, so according to dosha dominance, you can select a specific snehas, and you can go for a Virechanadi Karma or Vamana Karma or Basti Chikitsa, and plus important treatment principle is explained is Uttara Basti Chikitsa. In cases of Vata dominant Shukra doshas or Vataja Shukra Dushti, you can go for one Niruga Basti and Anuvasana Basti combination for Yoga Basti schedule or Karma Basti schedule or Kala Basti schedule. Pittanuvandi Shukra Dushti Rogas, Abhiyamaliki Rasayana can be given. And Kapanuvandi or Kafajat Shukra Dushti, you can go for Magadi, that is Pippali, Amalaki, Loha Basma. Then Trifala, Bhallataka Rasayana can be administered. Shukra Sruti Dosha Hara Chikitsa, Shukra Gata Vata Chikitsa, Vata Hara Chikitsa, Vajikarana Chikitsa, Shukra Vrata Vata Chikitsa, Shukra Vega Nirodhaja Chikitsa. Then Samanya Chikitsa, Snehana, Svedana, Sneha Virechana, then Asthapana, Anuvasana, Vishesha Chikitsa, Bijopaghata Chikitsa, Jarasambhava Vajikarana Chikitsa, then Bhajopaghapaja Chikitsa and Vranavat Kriya. Other factors, Purusha Bhava, Stri Bhava, Kriya Bhava, Rutu Bhava, and Mano Bhava. There are factors are many. I'm not going because we are running out of the time. So I'll be going a little bit skipping some of the slides. So Purusha Bhavas, Nirvyadihi, Nityagaha, Yuva, and Sankalpa. Stri Bhavas, Stri are considered as a Vajikirana Kshetra. Stri is not Vajikirana, but Stri is considered as a good Kshetra for Vajikirana because Apatya depends on Stri. That is why she is considered as one of the best Vajikirana Kshetra. It is not Vajikirana, it is a Vajikirana Kshetra. So some of the acharas and aharas, Ghata Kshira Bhojana, Vajikirana Yogas, Abhyanga, Utsadana, Snana, Gandhamalya Anulepana, and Vibhushana, Gandhamalya Akushta, and Griha Shayya Sukha, all these considered as a Kriya Bhavas. Rutubala Bhavas, as we know that in Grishma Ritu, the intercourse should be done in 15 days, once in 15 days, in Vasanta Sharad Ritus, once in 3 days, in Pravrit or on sunny days, you can have so many times as per your wish, Shishira and Hemant Ritu. Then Manobala Bhavas, Yat Kinchit Madhuram Snigdham, Jivanam Guru, Harshanam Manasaschaiva, Sarvatat Rishamuchate. So all these considered as a Manobala Bhavas. And sex education, Shasha, Vrishabha, Ashwapurushaha, so many things have been told. Surupa Yauvanaha Striyaha, Shikshitaha. So all these things have been told in Ayurveda. As you can go for a sex education. Yachas 3, Vrishatamaha Mataha. So sex education components are also explained in Ayurveda. So that can be incorporated. So that is why keeping all these things, when Acharya Sushruta explains the definition of Vajikirana, he added so many beautiful things. Alparetasaha. What is Alparetasaha? Prakriti Vastokaretasaha Ticham Api Apyayan Nimittam. So Alparetas, what is the treatment? Apyayanam. Dushtaretas, what is the treatment? Prasada Nimittam. And Kshinaretas, what is the treatment? Upachaya Nimittam. Brahmana Chikitsa has to be done. Vishushkaretasam, what is the treatment? Shukra Janana Chikitsam. Then Alparetasaha Panchavimshatim Taptaha. So after the age of 50 years, it is called as Alparetasaha. That is called as after the age of 50 years, there is an andropause. So this is what Acharya Sushruta explains. After the age of 50, there is an andropause. Then Kshinaretasah Karanat Alpi Bhutaretasah Shukrareto Vruddhyaha. Further he says Praharsha Jananartham. So Vajikirana Chikitsa is not only for having the children, it is also for the Praharsha Jananartham. What is Shukra? Shukra is representing Bijam. Shukra represents Pumsatvam. It also represents the Rupadravyam. And representing Semen, Ananda, Samudbhavam, Tejas, Rupa, Rupadravya. All these things are considered as a Semen. Representing sperm, it is Bijam. Shukra representing the Semen, it is entirely Vata. Then coming to the next point is representing the androgen component. Purusham, virility or Bala, Indriya, all these things are words used for identifying the Virya. Virya is androgen component or hormonal component. Semen is considered as a weight test. So whatever the test we are doing, the semen analysis is Veto Pariksha. Shukra and sex hormones, location, origin, all these things, all these things. Shukra Veto water. Shukram Namchiti Varnati, Shukri, Vatna Katya, Vikati, Zaniya Chati, Shukra Katya, Arina. When the aggregated water is applied, they will sufficiently Shukri Katya and produces Shukra Veto water. Vikati is Zaniya Chati, Vikati is Zaniya, normal, Garbha is body. Many times there is a stigma in the society that अगर स्कैनिंग करेंगे तो डेवलपमेंट फिटनेस का डेवलपमेंट अच्छा नहीं हुआ है तो वो स्त्री का स्त्री के इसके कारण से दिया ऐसा नहीं है वेरी क्लियर कट एक्सप्लेन कर दिया विकिटिंग जनरेट ये गर्भ में विकिटिंग जाता है retardation IUGR is there, it is because of the Shukra Dhatu, not because of the Artava. Ashuddha Shukra is the whole responsible for the formation of Kshipram Munchati. Or very late deliveries, or miscarriages, or it's intrauterine growth retardation. Everything depends on the proper Shukra Dhatu. That's why it's very important that we have to identify the Shukragata Vata Lakshanas. Chikitsa Harsho Annapanam Shukrasthe Bala Shukrakaram Hitam Vibadha Margam Shukram Dadyat Virechanam. So if there are any blockages, you have to go for one Virechana, one Uttarapasti you can also do. Harsho Annapanam. So Harshana Chikitsa, lack of desire. So you have to give the treatment for Harsha Chikitsa, then followed by Shukra and Bala Karaka Chikitsa. So all Brahmana, Balya, whatever the Shukra, Balya, Brahmana, Vajikrana, Dravyas or Lehas, Avalehas, Ghritas have been told, you can advise into this particular condition. If there is a blockages in the Shukravas rotas, then you can go for one Virechana followed by Uttarabasti. Further, Sushruta explains, Shukra dosha pramehastu vyanapana prakopajaha. Sushruta says, yeah, all the Shukra doshas are treated on the lines of, because there is involvement of Vyana and Apanavata Dushti. So you have to focus your treatment on, along with Samanavata, your treatment should also focus on correcting the functions of Vyanavata, because Vyana is responsible for deposition of semen in the high up in the vagina. That is why Chikitsa of Vyanavata is very, very important. One Virechana and one Uttarabasti will help you to improve the functions of the Chikitsa of the Shukragata Vata. So Majja Shukra Samuthanam Aushadam Swadutiktakam Annam Vyayama Shuddhihi Kalecha Matraya. So Madhuratikta Annapana has to be advised, and Vyayama has to be advised. That is, Kegel exercise are very, very important. Abdomen exercise, 4 kilometers per day walking, along with the Kegel exercise are very, very important as a Vyayama. And proper Vyavaya knowledge, and when to go for proper intercourse, how to do proper intercourse, all these things you have to go for a couple counseling. So treatment principles, Sastheya Vajikarana, Shukra Doshara Chikitsa, Shukra Sruti Doshara Chikitsa, Klaibhyahara Chikitsa, and other diseases the person is suffering from, all those treatment has to be adopted. Just I will brief you two cases because we are running out of time. So a patient who is having who is a worker as a contractor and having a married life of 8 years and anxious to conceive and not having issues since 8 years of married life. So he don't have any premature ejaculation, erectile dysfunctions are not there, no history of typhoid or mumps or any high grade fever or any surgical interventions. He was not non-diabetic, non-hypertensive, and there is no any Santaptamatha Lakshanas as per the blood investigations. But patient is having obesity, is a Stauler, and having 170 centimeters height, and BMI is 32.5. So wife is not having any issues, and they underwent for 3 sittings of intrauterine insemination, and they were suggested to go for IVF. So what was the cause for this particular patient? Akala Bhojana was there, Akala Shayana was there, that's what I told you also. Sankirna Bhojanas, all complex food, all outside food, all Viruddha Aharas, everything contribute for the Shukravas Sotodushti Nidanas. Viruddha Bhojanas, Atiyana, then Vegadharana, all these things are contributing factor in this particular patient, so which aggravates Samanavata and Vyanavata. So this was the investigation which was done, and it shows seminogenesis was normal, but there is an increased liquefaction time and there is an increased viscosity. So slightly viscous, increased viscosity, and liquefaction time was increased. So the same semen was used for 3 IUI sittings, which was not shown any outcome. So this is very, very important that from the perspective of Ayurveda, so you have to identify this particular domain. When a patient comes to your OPD with a history of hyperviscosity or increased liquefaction time, so the first and foremost thing you have to ask the patient to go for IUI or IVF. So because naturally hyperviscous semen will not yield any outcome in doing IUI. So that is why the first and foremost thing what you have to do is your initiation of proper diagnosis is very, very important. It is a Kapaja Shukra Dushti. Increased Ati Pichila Guna in Shukra Dhatu has resulted into reduced liquefaction time or a reduced viscosity. So viscosity is increased and liquefaction time is increased. So that is why the best option is Kapacha Shukra Vishti Chikitsa. If you do apply the Kapacha Shukra Vishti Chikitsa, the patient will automatically improve and conception will happen in the next 2 to 3 months. So, Kapha which is making Avarna to the Samanavata, Kapha which is making Avarna to the Vyamavata. So, Kaphavrata Samana and Kaphavrata Vyamavata Chikitsa is the line of treatment which we need to adopt. So, Kapha Shukra Vishti Chikitsa, Leda Neda Kapha, Kapahara, then Guru, Snigdha, Shika, Pichela, Gunas are involved in the pathology. And the best line of treatment for the Kapha is Langana, and best line of treatment for Neda is Lekhana, and best treatment for the Shukra dosha involvement is Shukra Jana. So, Kathagnam, Nirodhanam, and Shukra Janaka Chikitsa. All these things has to be followed in your treatment. Then only the results can be observed. You can see the treatment after 1 month of after that. If we go for we did a semen analysis because of this new usage, because of the administration of Kapahara Chikitsa, you can see the volume is reduced. But you can see the liquefaction time came to normal, viscosity came to normal. So the semen analysis is also normal azoospermia, and you can see the count, that is 170 million per ml. So that is why the normal morphology is also increased, normal semen count was also improved. Our objective is to bring back the normal viscosity. Whatever the increase the pitch level of the Kapha is there, so we have reduced by giving these are the treatment medicines which we have advised to the particular patient. Initially, we have asked the patient to take Chitrakarivati, 1 tablet 3 times a day before feeding Fujara for 10 days. Then we have prescribed Part-2 because there are 4 important ingredients. So Part-2, all the 4 drugs are there. So we have prescribed that. That is one of the best yoga which is explained by Yoga and Chakrabarta in the context of Kapaja after the history. The same thing is advised in this particular patient because of very easily available drugs, which was continued for 1 month in Kapameda Harapatya and advice. All the clinical outcome got conceived in the month of November. So 3 months of this August, human analysis was done. In the month of November, she got conceived, and he lost about 4 kgs. In the moment we have started prescribing the Part-2. So weight was reduced from 90 to 86 kgs. So next is 30-year male from Hubli, who is a worker in the factory in shift duty. Why this is very, very important? This working pattern will give you an indication of underlying dosha drishti. So shift duty, akala shayana, akala bhojana, all these things comes into picture. So with a history of married life of 4 years, basically with 88 kg and 162 centimeters, BMI of 39, and no case of diabetic since 1 year. Then non-hypertensive and no lipid profile.
Sir, sorry to disturb. Voice is not clear.
My voice is not clear.
Now it's clear, sir.
Now it's okay?
Yes, sir.
Okay. So no history of premature ejaculation or erectile dysfunction, no history of any viral infections. A testicular scan and hormonal assays were normal. Then his wife is 24 years and no abnormalities were detected. IUI done one time, and they don't want to go for IUI, so they turned up to Ayurveda, and they have consulted our hospital in Hubli, Ayurveda Mahavidyalaya Hubli. So hetus were Ruksha Ahara, Vishamashana, Langhana was there, then Akala Shayana, Akala Jagarana or Akala Bhojana were observed, and he's a worker in the factory and he has to do more physical activity, lifting and carrying and working in a more heated areas. So Dushti, Rasa Dushti was there, Meda Dushti was there, then Shukra Dushti was there. So when we advised the patient to go for a semen analysis, it was found to be azoospermia. So absolutely there were no active motility, sluggish motility, non-motile pus cells were not there, but we could not able to find any single spermatozoas in this particular patient. So it was completely azoospermic in its nature. It was a non-obstructive, as because there are no obstructive positive factors after doing scanning. So you can make Ayurveda diagnosis as a Nastaretas, where Sadushti is there, Kapameda Savrata, Vata is there. So which Vata Samana and ultimately Vyanavayu, and involvement of the Pranavayu, as there is involvement of Atichinta and Nidra Viparya is there. Aprinanam and Bija Anutpatti. So there is no lack of nutrition to the Shukrava Srotas, and the Bija Utpatti is not happening. So you can conclude it as a Nastaretas. Vishishkaretas is also mentioned by Acharya Sushruta, but Nastaretas is giving you the proper diagnosis as a azoospermia. Then the medications which we have suggested is for proper rukshana and cleansing the srotasis. We have advised the patient to go for shadharanam before food with hot water. Amashayagata vata chikitsa and kushtaroga adhikarana, it is mentioned shadharanam. So we have given shadharanam 1 BD. And further we have advised the patient to go for Varanadi Kashayam in the initial phase, 10 ml thrice a day after food with hot water. Then Ayurvedic Churna was given at before dinner. So many a times when we ask the patient, बहुत सारे डॉक्टर्स को हम बताते हैं कि Ayurvedic चूर्ण कब देना है, या कोई भी लैक्सेटिव आयुर्वेद का कोई भी देते हो तो कब देना है, तो रात को खाने के बाद देना है. रात को खाने के बाद आप अनुलोमन द्रव्य या विरेचन द्रव्य देते हो तो उससे आपको मलाशय या पक्वाशय शोधन नहीं होता है. तो उसके लिए होता है वो ब्रेन के ऊपर एक्ट होता है, क्योंकि खाने के बाद जो दवाई दी जाती है तो वो इट एक्ट्स ऑन द ब्रेन. Constipation is not at the nervous system, constipation is there at the gut level. So our focus should be administration of all anulomaniya dravyas, sukha virechaniya dravyas or malanulomaniya dravyas should be given with hot water before dinner. So that is why it's very, very important. All clinicians, please note that try to advise Trifala Churna, Avipattikara Churna, Panchasakara Churna, Swadishta Virechana Churna. कोई भी आप अनुलोमन द्रव्य या लैक्सेटिव द्रव्य देते हो या लॉन्ग टर्म में कॉन्स्टिपेशन पेशेंट को भी देते हो तो, या एरंड तैल देते हो, कुछ भी तैल वगैरह कुछ भी देते हो तो रात को खाने से पहले गर्म पानी के साथ देने के लिए बोलना है. It should not be administered after the food because it won't act at apanasthana. If a drug has to be given before food, before dinner, it acts at apanasthana. Though Sadushti is there at apanasthana and you are giving medicine after food and it is reaching to pranasthana. So which vata you want to advise, which one vata you want to address in your treatment, accordingly you have to give the treatment. Further, the semen analysis was done. So you can see the improvement in the count. So 8 million spermatozoas were seen. Then further medications were continued, Shadharana dose was reduced. Then we have added Vidaryadi Kashaya instead of Varanadi because patient was obese. Then Kapameda Kshaya was observed. Then we have added Vidaryadi Kashaya for the Brahmanartha, Shukra Jananartha. Avipattikara Churna was advised for Anulomanartha so that there should not be any blockages in the Shukravaha Srotas. Further, next analysis was done on next 1 month after. So you can see that from 8 million it has increased to 9.1 million. Then further medications were advised. Shadharana was continued. Chandra Prabhavati was added as a Rasayanartha. Then Gokshuru, Shunthi, Ashwagandha, Kapikachu and Guruchi. These are the Katha Churna. Third Churna ko inko bana ke de diya. तो उसको कषाय बना के पीने के लिए दे दिया. तो 2 बार खाने से पहले लेने के लिए बोला है. This was the combination from Yoga Ratnakara. So nothing is from my end, everything is from the Samhita only. So all credit goes to Acharyas and Samhitas. So Gokshuru, Shunthi, Ashwagandha, Kapikachu and Guruchi was the one of the beautiful combination. You can add on Swarna Basma or you can add on Abraka Basma, you can add on Vanga Basma or you can add any of the Trivangas or any of the Basmas which are having Rajata or Swarna Basma depending on the patient's financial part or from your making combinations. So उसको भी ऐड करके आप देते हैं तो जल्दी से आपको शुक्रजनन होता है. तो आगे हमने नेक्स्ट मंथ को हमने जनवरी में एनालाइज किया तो from 9.1 it has increased to 18 million. So further medications were continued. One Virechana was given with a Trivrtleha. Snehapana was done with Dadimadi Krita and Varnadi Taila was done. Varnadi Taila was used for the Sarvanga Bhengasveda as patient is obese and Varnadi Taila is indicated in Kapameda Kshaya. and in Sthola Purusha. And after Virechana, the same Kashaya yoga was prepared and asked the patient to continue. So उसके बाद you can see the from directly 18 million it has went up to 76 million. So Virechana plays such an important role in managing the male infertility. Virechana and Uttara Basti, they are the very important line of treatment in management of male infertility. आप एक विरेचन दे दो या बस्ती दीजिए या उसके बाद उत्तर बस्ती दीजिए तो उससे आपको जल्दी से इफेक्टिव मिल सकते हैं। जो भी साध्य व्याधि होते हैं शुक्र प्रदोष जो विकार होते हैं उनमें से हम एक विरेचन एक बस्ती या उत्तर बस्ती दे सकते हैं। सो विरेचन के बाद if patient is not fit for kashaya bastis, you can directly go for uttara basti. Uttara basti is a very simple technique which you can do at the OPD level also. So which is very easily. Only thing is you have to focus is all aseptic precautions should be taken very properly, systematically you have to do it. So room should be very clean and hygienic and you have to do it in more aseptic areas. So you should not supposed to go for any causation of the ascending infections. So that care if you take, you can do at OPD level also. So clinical outcome, diabetic index controlled, HbA1c has reduced from 8.5 to 6.9 and weight has reduced, patient has reduced his weight to 74.5 kgs and his wife got conceived and delivered a male baby on 6th January. So this was the outcome. So with this, I would like to conclude and thanks for the opportunity given. If anything, anyone would like to ask any question, you may ask. Thank you very much.
Thank you so much. We are come to end of this session, this wonderful session. It's my honor to present the vote of thanks. I heartful thanks to Dr. Pramod Katti sir.
Thank you so much for delivering such a complex and clinical concepts with such ease and thoroughness, sir. It was indeed a very enlightening session. I welcome Dr. Syed Nizam Ali to please propose a vote of thanks and we'll take up the question later.
Okay, thank you, Shitya. As we come to the end of this wonderful session, it's my honor to present the vote of thanks. I heartful thank to Dr. Pramod Katti sir for explaining today's topics so clear and beautiful. Your insight will surely help to understand and practical Ayurveda is better way. A special thank to Dr. Deepali who worked hard to every step to make this event smooth and successful. Thank to Dr. Kalpesh for adding creative and value to this program. Knowledge truly shining when it is presented with clarity. Thank you, Dr. Shraddha, joined for this session as a volunteer. We also appreciate Dr. Sipriya for always being a constant support for our initiative. Our gratitude also goes to our digital partner, the real backbone of this event. Because of your support, Ayurveda is reaching thousands of learners. We enrich everyone to follow the support them and stand wise Ayurveda. Finally, I am warm thank you all participants. Your presence, energy, and support make Ayush Gurukulam and Zenith Ayurveda true family for learner and healers. With gratitude, we conclude today's session. Thank you everyone. Now session is on for questions.
So yes, sir, there are some questions. Can I read?
Yeah, please.
First is the role of antifungal treatment in infertility.
The question is from modern perspective or Ayurvedic perspective? Antifungal is, if you think from Ayurvedic perspective, if a patient is diabetic and if you want to give for antifungal treatment, the best treatment would be Aragvada Mahatiktaka Kashaya, Aragvadadi Kashaya, tablets. Or Kashayam, you can give in antifungal treatment or all antifungal treatment, especially from Ayurvedic perspective, reduces the Sroto Avaroda. and they reduces the load of the fungus. So if a person who is suffering from TC means tinea cruris, or itching and scabies, or any local groin region or testicular region which is involved with tinea infections. So, tinea infections can be managed with Ayurveda. So, if you go for modern allopathic treatment, tinea infections are suppressed, and any local topical application can be made use of. But if you go for Ayurvedic treatment, that will add on to recovering the patient very beautifully. So I suggest that without going for a modern medicine, you can try out Ayurvedic medicines, which will definitely reduce the fungal infections. So if you prescribe a fungal infection from Ayurvedic perspective, all kushtagna ganas, all kushtha nikarana avasthanika chikitsas will also directly affect on the Medovaha Srotas along with Shukravaha Srotas. So definitely it will add on to the benefit of male infertility. Next.
Yes, sir. Next one. What are the limitations in treating male infertility cases in Ayurveda?
Limitations are very, very important. So when obstructive pathologies are there, when azoospermic are there, when obstructive, when hormonal abnormalities are there, when the genetical components are involved, or when the sahaja shukravaha sroto vyadhis are there are certain sort of limitations are also there. When testicular atrophies are there, so we cannot do much of the treatment. We have did few patients where we got the good results in testicular atrophy also, where we did Karmavasti for 6 sittings. You didn't believe that we have did a Karmavasti with Aja Bastandas, or the goats of the testes. Testes or the goats' testes. So this is a famous Basti Yoga which we use in cases of testicular atrophies. We did it for 30 days of Basti for 6 sittings. So we did it entirely 1 year, and at the age of 45, we did it, and at the age of 47, they got conceived. So that was a wonderful treatment, but we are not getting the same results in other cases. So there are so many limitations. A testicular atrophy, some patients respond, some patients may not. That time we don't have much of the investigative tools. Now all the things are available. We can investigate, document, and we can treat accordingly. There are so many beautiful yogas which are mentioned in the Vajikarana, Adhikarana of Charaka and Sushruta, which are useful for the treatment of Vastanda Prayogas, or Mashadi Kalpas, or you can go for one best Vrishabastis, Kshiravastis, or Madhugratadi Vastis, or you can go for Mustadi Yapana Vastis, or Tritiya Baladi Yapana Vastis. All Baladi Yapana Vastis, what Charaka has explained, all are absolutely useful for the such clinical condition. But there are certain limitations where surgical intervention is mandatory. Such clinical conditions are asadhya rogas, where undescended testes are there, testicular atrophies are there. So they are also asadhya vyadhis. So they are the limitations. So these are the basic limitations which we come across in our practices. Some of the hormonal hypogonadism are there. So all these are some of the limitations where we cannot do much of the treatment. Rest other things we can treat. Next.
Okay, sir. If anyone want to unmute, you can unmute now. There is one more question. What is your comment on virtual azoospermia and how to understand it and treat it?
What azoospermia?
Virtual azoospermia.
Virtual?
Yes.
What is virtual? Now we are in a virtual meeting, no?
Okay.
And I could not able
So
to.
basically it is writing, is your comment on azoospermia maybe?
Hmm. What was their comment? Just go through it.
I think it is mature azoospermia, maybe. How to understand it and treat it. There is one more question. There is some case presentation given. Presentation.
Azoospermia was the diagnosis. FNSE has shown no mature spermatozoa seen. When estradiol was increased, then weight was more. He was a shopkeeper. Testis size was small. So it is a santarpanotha vyadhi. Patient is 102 kg weight, and estradiol is increased, and there is a possibility of obstructive variety of azoospermia. So you can, the best option would be, as patient is santarpanotha and obese, so you can directly go for one rukshana chikitsa, abhyantara and bahya rukshana chikitsa, one udvartana chikitsa course of 15 days or 21 days, by looking into the samyak rukshita lakshanas. Very, very important thing. So when you go for any rukshana chikitsas, you should always observe the samyak rukshita lakshanas. If you don't follow the samyak rukshita lakshanas or samyak langhita lakshanas, patient will go into dhatukshaya lakshanas. So dhatukshaya will lead to once again vata prakopa, once again shukrakshayas. So when you initiate the langhana and rukshana chikitsa, or we go with one trifala udvartana or kola kulathadi udvartana or any of the varnadi churna udvartana, you can go for any type of udvartana. Only thing is how you have to observe is a samyak rukshita lakshana, abhyantara rukshana or bahya rukshana. You can do any one of the thing. Samyak rukshita lakshana, samyak langhita lakshana. Once you observe, directly shift the patient to the virechana karma or basti chikitsa. So if you do it for on the 3 to 4 sittings of rukshana and rukshana and basti, patient will definitely improve. Count will also come and increase, and along with the mature spermatozoas will also, you can see in the FNAC. So as there is blockages, the mature spermatogenesis will not happen. Whatever the spermatogenesis happen, that will be absorbed inside the testis itself. That is why maturation is not happening. So maturation requires proper functioning of the Agni in the presence of the Samana Matra, in the presence of the Alpa Sneha. So whenever Agni को आप ज़्यादा बढ़ाना चाहते हैं तो थोड़ा थोड़ा अग्नि डालना है, घी ज़्यादा डालोगे तो अग्नि मंद हो जाएगा. तो इसलिए आपको जब भी ऐसे पेशेंट मिलते हैं जो स्थूल होते हैं, संतर्पणोत्थ व्याधि से बना हुआ होता है, तो वहाँ अच्छा सा रोक्षण करना है, लंघन करना है, लेकिन सी टू इट दैट धातुक से नहीं होना है. तो उसके साथ साथ बस्ती देना है, उसके साथ साथ हो सके तो एक विरेचन दे के बस्ती दे दीजिए. डेफिनेटली पेशेंट विल रिस्पॉन्ड विद इन 3 to 6 months. हाँ, ठीक है. नेक्स्ट.
You can mute your mic and ask question. Nishan Yadav.
Namaste, sir.
Namaste.
Sir, nowadays in
I'm not getting your question.
hidden sperms known as virtual. Sir, can you hear now, sir?
हेलो. हाँ बोलो, सुनाई दे रहा है, बोलो.
After semen analysis, if the reports are shown azoospermia, even after some centrifugations, they find hidden sperms in with the reports of azoospermia also, sir. Which
Okay.
they have noted it as hidden sperm or virtual azoospermia.
Virtual azoospermia. Azoospermia, cryptoazoospermia. It is also called as cryptoazoospermia. Crypto means very small.
To understand this in our Ayurveda and how to treat it.
Why? That is yes. That is a clue for a clinician that the patient will definitely improve. If a patient is not showing 1 or 2 spermatozoas are there after doing rigorous centrifuge, and they will get 1 or 2 spermatozoa, live sperms are there, that is an indicator that the testes are functional. That is an indicator that if you give Shukra Janaka Chikitsa, definitely patient will respond. So best option would be you can go for Virechana followed by Basti Chikitsa. One Vrishach Basti will definitely help you to increase the spermatogenesis. So if total azoospermia is there, then that is a challenging or limited case. So why such reports are giving is, so that is helpful whether patient's spermatogenesis will happen or not. That is the best opportunity for Ayurvedic practitioners. How much it is good for allopathic doctors, I don't know. But from the perspective of Ayurveda, that's the best diagnostic tool to adopt Shukra Janaka Chikitsa. You can prepare a Shukra Janaka, Shukra Shodhana Ganas are there, no? Shukra Janaka, Shukra Srutikara, drugs are there. So you can prepare the same Kshira Basti, add with Ashwagandha Ghatha, and go for Basti Chikitsa. You can go for 15 days, one Karma Basti or Kala Basti. Don't go for Yoga Basti. You do Karma or Kala Basti. So one Virechana, one Kala Basti, 3 sittings, patient will definitely improve. Patient is, if you don't practice Panchakarma also, you can directly go with Shamana Chikitsa. One Vangavasma tablets are also available. You can give, or Bija Pushti Rasayanas or Rasa is also available. So you can prescribe that. Or you can make the combination of medicine which I have shown. So that can also be done. That will definitely improve the count.
Okay, sir. Thank you, sir.
Thank you so much, sir.
Thank you.
For giving your time. Sir is so much busy in clinic and college also. But sir ने हमारे लिए यहाँ टाइम निकाल के आया, इसलिए मैं सर को एक बार और फिर से थैंक यू बोलना चाहता हूँ.
आज ज्यादा हो गया सुबह से काम, और आज उपवास भी है, रात को 11 बजे तक हो गया. Okay, thank you so much. All of you.
Thank you so much, sir. Thank you so much. It's an awesome lecture.
ठीक. Good night.